Welcome to today's event, Behind the Scenes with Results, Saving Foreign Aid, Medicaid, and SNAP, brought to you by Results' Development Office. I'm Melissa Strobel, Results' Director of Development. This event is being recorded, and we will share the link in a follow-up email. Now please join me in welcoming Joanne Carter, Executive Director of Results and Results Educational Fund.
Thanks so much, Melissa, and really grateful to gather with so many of Results supporters this afternoon. I know that some of you are joining a Results webinar for the first time. Some of you have been on many webinars. Some of you recently made a donation for the first time, and some of you have been donors almost since the beginning of our work for the last 3 or 4 decades. I just want to start by saying I am so grateful to each of you because your support makes what we do possible. And especially in this moment, the ability to respond and pivot in this incredibly challenging time for our country and the world. We are definitely gathered at an unprecedented time. I feel like we actually need a new word. There's almost not a word that quite describes where we are right now. But in January of this year, as many of you know, the State Department announced a freeze and then a stop work order on almost all U.S. foreign assistance for a supposed 3-month review process. And that's even if the programs had money or medicine or food ready to deliver. And weeks later, in the face of court challenges, the State Department terminated almost all foreign aid programs. Results turns 45 this year. I've been with Results for more than 30 years. And I can say that the impact of this is unlike anything we have seen in our history. It's been catastrophic and also immensely cruel. Just as examples, health clinics in Sudan, including stabilization centers for babies on the brink of starvation. These programs received a humanitarian waiver, meaning that even by the administration's own analysis, they were life-saving, yet they were terminated. And the impact on HIV and tuberculosis and malaria treatment and prevention has already been enormous, and it's going to get worse. The Center for Global Development, a think tank not given to hyperbole, estimates that something like 1,650,000 people could die within a year without U.S. foreign aid for HIV prevention and treatment. The impacts of PEPFAR, the President's AIDS Initiative, launched over 2 decades ago, working with affected countries and communities, has been one of the most astonishing accomplishments in human history. Along with the revolution in child survival, the eradication of smallpox, really one of the most astonishing accomplishments. We helped transform this raging killer that was AIDS into a chronic disease. Our Tanzanian colleague, Dr. Peter Bujari, was interviewed, many of you might have heard it, on NPR. And that was thanks to connections our staff made with NPR folks, and it played last week. And at the end of that segment, he was asked if he could speak directly to decision makers in Washington, what he would say. And he said, "I would say that they have done an amazing work to approve PEPFAR and USAID funding that has saved millions of lives. In such an abrupt disruption, it is telling those people, you can now die." But we have been and are in action to respond. I was at an international TB, and my colleague Colin, who's on this call, was there as well, TB and health meeting in Istanbul in late January, when the US government announced this immediate stop work order on all health and development and humanitarian programs, including many community-based health programs run by people in that room. And that very evening, Cricket, who's also on this call, sent out an urgent action alert to our Results volunteer advocates to reach out to Congress and the media to call for reversing this. And we have been reaching out aggressively to members of Congress ever since. Our advocates have held nearly 100 meetings with members of Congress, Republican and Democrat, and their staff since January 23rd. And Results staff have also had dozens more meetings on Capitol Hill. And we are in almost constant communication with allies and partners in the US and around the world. We've had over 100 media pieces published by our grassroots and many more that our staff has supported journalists and reporters on in writing. And our broader network has reached out thousands of times to members of Congress. And, it's not, we haven't seen enough of a response, but we are seeing some impact. Some global health and humanitarian assistance programs have received word that their terminations were rescinded. Critical nutrition, HIV, TB, and maternal and child health programs. Too few and far too slow, but a number of life-saving programs, and we are continuing to push and not giving up. And we're also fighting, and you'll hear more about this, but both this year and next, to hold on to foreign assistance resources through the annual funding process so that programs and communities they support are not erased. And we're also mobilized against threatened massive cuts to Medicaid, which provides, again, health insurance to low-income individuals and families, to people with disabilities and more, and SNAP, which is formerly food stamps, and other essential programs for people struggling with poverty in the US. To prevent these programs from being slashed in order to offset extending tax cuts for the very wealthy and corporations. And I would just say that, our work to impact Congress, despite the challenges we're seeing with Congress, despite how hard that looks, our work to impact Congress is more important than ever. So thank you for your support to make that possible. Many members of Congress in the majority party are reluctant to speak publicly in this time, but many are concerned and frustrated. We have allies and some real champions for these programs, but they need us to help mobilize support for them to stand up and protect international and US programs to fight poverty. I do believe our theory of change, our model works and is more important than ever. Courts are incredibly important, and the work that courts have done to reverse and hold up some of these actions by the administration. But without Congress standing up to claim the authority they have, the courts alone cannot stop or reverse this damage. And also on the US poverty side, Congress in the next months is going to have decisions to make on hundreds of billions and even trillions of dollars, and they need to hear from constituents. So our plan for this webinar, and I'm really grateful we could gather today with supporters to share what we know, offer a behind the scenes view, especially as the news sources aren't really always sharing the full picture. Some of what's shared isn't accurate. And so we want to share what we've been hearing and what we've been seeing, again, some of which Congress won't say out loud. We also want to be in a real conversation and have time to answer as many questions as possible from you all. We've taken some in advance and we'll wait to hear them in person. So please do put your questions in the chat at any time. You can also raise your hand using the hand icon at the bottom of your Zoom screen. And my hope is that you'll come away with a greater understanding of what's happening, the urgency of this moment, the need to react, but also to be proactive, and also the real importance of our advocacy. So today, my colleagues are here today. Tashawn Thomas is Results Interim Vice President of Advocacy and Campaigns, and also Director of US Policy. So he's responsible for our US anti-poverty campaigns and sees the full breadth of our work to mobilize our national network of advocates. Colin Puzo-Smith is Results Director of Global Policy, so he drives our global work on health, nutrition, education. He's been at Results for a decade now and previously led our work on communications and grassroots expansion. And then Cricket Nikovich is Results Director of Policy and Government Affairs. So she manages Results relationships with congressional and administration offices and leads efforts to build champions among members of Congress through direct engagement and support of our advocates. So I'm going to start with a few opening questions and a little bit of back and forth and dialogue, and then we'll open it up to your questions. So Colin, question first for you. Can we start, starting with the foreign aid shutdown, can you share a little background on the range of programs that are funded through the U.S. Agency for International Development and what's been happening over the last several months that shut most of them down?
Yeah, and hi, everybody. Really good to be with you. And as we were getting ready for today's conversation, I was thinking about, and this is a thought I've had repeatedly over these last few weeks, that really two of the things that are sustaining me in this time, one is the network of our grassroots volunteers, and many of whom I see looking back at me, because the only chance we have to stop this destruction, as Joanne was just saying, really is Congress. And the only way they will do that is if we get them to. And the second thing that is sustaining me is the commitment and the fortitude and the solidarity of our international partners, like Dr. Bujari and many others. And they are standing with us through this time and what's going on here. And that is motivating me to remember that we need to keep standing with them. So to all of you who make all of that possible, I want to say thank you. I've worked, Joanne just said it, I've worked here for a decade. Joanne has a couple decades on me. But these last 6 weeks have been just absolutely the worst in that time. And yet I have never felt more committed and more grateful that I get to be in a job where I get to respond in this moment. So thank you for making this whole network possible. A little bit on what's happened in these last 6 weeks on global poverty, because the administration has really dismantled foreign aid with a ferocity that I don't think anyone imagined. And in a lot of ways, I don't even know that they had intended at the start of this year. So Joanne mentioned on the very first day of the Trump administration, they started with a 90-day freeze on new foreign assistance and this review. A review of USAID programs in good faith, that is something we would absolutely be up for happening. Because finding ways to help foreign aid reach more people, save more lives, have more impact in more places, that is something we'd be all in for. From the very start of results, we've been known, I will say, for pushing bold funding asks, but our ask with Congress is never just more, more, more. It is also better, better, better that we're pushing for. Making sure that the money that goes to global health programs, to global poverty programs, to global education programs is not just increasing, but actually increasing the impact that it's having in the world. So we'd be up for reform, but no part of what's happened in the last 6 weeks has been a good faith reform. So theoretical review announced at the very start of the administration. Then, as Joanne said, 4 days later, we had a stop work order where everything ground to a halt. After what was justified outcry, the next week, Secretary Rubio announced that there would be a set of waivers for life-saving humanitarian and for health programs. And this was absolutely a step forward. It did eventually allow some programs to restart, in theory, but many, many more, including life-saving programs, stayed shuttered. And even the ones that did get a waiver didn't start getting money. Then the weekend following that, we saw the shuttering of USAID, and you all have seen this in the news. That meant not just that an agency was closing down, but that the staff who would be theoretically able to submit waivers, approve waivers, process payment, implement the work, didn't exist anymore. And so the consequences started overnight. And this 90-day review, 90-day stop work order, a woman in labor, a child with malaria can't wait hours, much less days or weeks. And this is what was happening. And so a number of our partners here in the US launched lawsuits in response to this. But then rather than complying with that court order that came down in response to the lawsuits that said the administration had to restart foreign aid, instead the administration decided to terminate 90% of all USAID programs. And again, I know I'm sharing things that were in the news, but the chaos of all of this, I think, bears repeating to see the chronology of how things played out, because this was not just another pause, but ending programs altogether, including programs that had already gotten life-saving waivers. So just a stunningly cruel and reckless decision, and also a chaotic one, because some of those terminations then got rescinded within a day or 2 days or a week, which, to be clear, is a good thing, right? We were happy to see the rescissions. But what you had unfolding was this programmatic review, then a set of stop work orders, then waivers, then terminations, then termination reversals. In some cases, we saw rescissions of the reversal of the termination. Meanwhile, at USAID, because there are no staff, no one is answering the phone, no one is responding to emails, and there is no money. The payment system is off. So if you have been confused or overwhelmed by what's been happening during this time, you are absolutely not alone. And it meant that, not only were people implementing programs not clear what was happening, the public wasn't clear what was happening, people inside the administration weren't clear what was happening, but Congress also wasn't clear. And so on that's where I am so grateful for this network, because as members of Congress, we're trying to make sense of the madness of what was unfolding. So many of you and the people who all of you support were in action to make sure that Congress was pushing back. And we'll come back to that in a minute. Um, but to focus for a second on what this has actually meant in real terms, because the gutting of USAID is just like a spectacular breach of executive power. There's a huge long list of reasons not to do this. But ultimately, the point is not about the agency, it's about what the agency was doing. And it is really important that we continue to bear witness to this as a motivation to act and for members of Congress to act. And Joanne talked a bit about HIV. I want to give an example from nutrition, an issue that we have worked on for years. One of the most basic tools for malnutrition, and many of you who are involved in advocacy know this very well, is a fortified peanut paste. It's like a peanut butter that has extra vitamins and minerals in it. It's incredibly simple, but it is as close to a miracle life-saving tool as the world has. It brings kids back from the brink of death. And USAID has played a really critical role in getting this to kids who need it all around the world. And a lot of it gets physically made, manufactured in factories in Georgia and in Rhode Island before it then gets shipped out all over the world. So as one example, those manufacturers who are using USAID money to run their production lines got a stop work order, then a waiver, then a termination, then a rescission of that termination. And as of a few hours ago, money still isn't turned on. That means the Rhode Island manufacturer has gone public and shared that they had to stop their production lines for the first time in a decade. That is 415 kids per hour that aren't getting the treatment that will save their lives because those production lines are down. And that is just the start of the chain. So you make the peanut paste, but then do you have the contract in place with the ocean freighter to take it out of the port in Providence? Are the longshoremen there to unload it at the other end? Do you have someone who will drive a truck with the product from the warehouse, the gas to put it onto a motorbike and then on foot into the hardest reach areas in conflict zones, in humanitarian crisis areas and places experiencing famine? Do you have the health worker who is finding the kids who are actually at the most severe risk and the nurses and doctors to see them? And if any one piece of this chain breaks down, it can throw the whole thing into chaos. So this is one life-saving commodity, that peanut paste, and to say nothing of all the other nutrition interventions and prevention or the full spectrum of other work that USAID is funding. And to be really clear, all of this, the logistics and supplies, the health workers and teachers and social workers, the schools and clinics and shelters, USAID does not fund all of this for every issue, not by a long shot, but they play a key role at different points in all these systems. So when you're starting and stopping programs piecemeal and there's no information, it pulls the rug out from under the whole system. And for a parent with a child facing death, it doesn't matter if what got stopped is the manufacturing line or the cargo ship or the health worker or whatever else. What matters is your kid. And the other example that I won't go into detail, but maybe at the end I'll share in the chat. If you were going to read one thing about what has been happening from USAID, it is a piece that ran in the New York Times last week on tuberculosis. Again, I'll just tell you to read it because it is better than anything I could explain. But the two things that I encourage you to think about while you're reading it is the extraordinary lengths that community health workers who are now no longer being paid are still going to reach people who are sick. And to think about the role, especially those of you who are advocates and have been doing this work for a long time, those of you who have been funding this work for a long time, there is probably no single issue from the last 20 years that Results has played a more singular impact on than tuberculosis. And I want you to think about that when you're reading that piece. And I'll wrap up in just a second here, but you know, on a macro level, when we look across USAID's work, in an average year, they help diagnose more than 7 million people with tuberculosis so those folks can start treatment. Quality nutrition, like the kind I was talking about, for nearly 30 million children under 5. 12 million women had access to safe facilities for childbirth. And as I said, we'd be up for good review and reform if it treated those outcomes as a baseline. Many of those annual results I talked about are because of reforms that this network helped secure in the first place. Legislation that guides what USAID does, the work you all do in the annual appropriations process, where results volunteers dig deep into the wonky details of how the federal government gets funded, where we're asking for more, but also when we are asking for the reports and analysis from USA that shows what they are accomplishing, like those numbers I just shared back. We have that data because USAID shared it back with Congress based on the mandate that you asked Congress to set. We've got more that we could do. We are not opposed to reform, but this isn't reform. It's just been a destruction. We know that Congress has been and needs to be the bulwark for this, and there's a lot more we can and are doing to move that forward. So I know I just went longer than you wanted me to, but I'll wrap up there.
Thanks so much, Colin. And then we'll come back to more of that. I just want to also acknowledge in the chat our colleague Stephen, who's been a USAID leader himself. So I just want to say I acknowledge that there are people on this call who are directly impacted by this as well. Their lives, their respect for their lives work and the shape of their lives going forward. So I just want to say we're grateful for your service and really very, very sorry that this is happening, and we are fighting back, and we will continue to fight back. Tashawn, over to you. Congress is threatening deep cuts in US anti-poverty programs that support low-wage workers, families, kids, veterans, seniors in the United States. Can you give us a sort of very brief overview of what they're proposing and also why, and perhaps a little bit of how we are working to counter that? Over to you, Tashawn. Thank you.
Absolutely. So let me first start off with a quick timeline of how we got to this point. So there's been some confusion over hearing about the continuing resolution, the reconciliation, the appropriations process, and what all of that means for us right now. So a couple of weeks ago, the House and Senate both passed their budget resolutions, which is the first step in order to do the appropriations process of passing a budget for the fiscal year. And so the Senate and House took two different approaches to tackling this matter. The House wanted to do what was called a one big beautiful version of this that tackled the budgets for FY25 and 26, provided instructions for the expansion of the tax cuts from 2017. It also provided for the extension and the raising of the debt ceiling. However, on the Senate side, they wanted to focus on specific chunks of that and do it in several different votes. And so these instructions are required, once again, in order to provide instructions for how to even look at the budget process. Knowing that those votes could not happen in the Senate to do the one big bill version, there was conversation amongst congressional leadership, both on the House and the Senate, amongst congressional Republicans, to pass a continuing resolution specifically for fiscal year 2025, which is the fiscal year we're currently in now. And that expands, it goes until September 30th of this year. Had the Senate not passed this bill on Friday, we would now be in a government shutdown. That was averted. And so now And what was in that included cuts to congressional earmarks, which is how members of Congress bring home the pork, so to say, to their specific congressional districts or states. That was the majority of the cuts, but it also provided some blueprints of further cuts to programs in which we care about and prioritize, and I'll go over those shortly. But it also included something that has always been a bipartisan supported priority for us, and that's WIC, which is Women, Infants, and Children. It's a nutrition assistance program specifically for, once again, women, infants, and children. And their budget was increased by $500 million to now be $7.6 billion total for this fiscal year. Why that's important is because last year we were at risk of losing $1 billion in WIC funding, and there was a compromise to increase the funding for WIC to $7.1 billion last year. And the fact that it was not only kept but expanded showcases that there is true need amongst the program, and that it's once again bipartisanly supported. So that's, some upside to what has occurred once again for this fiscal year, once again, which runs through September 30th of this year. What is occurring now is how do we tackle fiscal years FY26 as well as the expansion of the tax credits from 2017. And so what's happening in terms of those conversations is that the House has specifically created instructions to do the following. They are going to make $880 billion in cuts to the Energy and Commerce Committee. This is where Medicaid sits. And so for Energy and Commerce, not only do they tackle commerce for trade and all of that, they also tackle two major items, which is our country's nuclear arsenal, as well as Medicaid. Now, when you have to cut $880 billion from a budget, and that committee, once again, mostly deals with the nuclear arsenal and Medicaid, which one are you more likely to cut? And so we have had conversations and have started to really target the committee in regards to prioritizing Medicaid. Of course, we've seen at different town halls, many veterans wanting to protect this program and constituencies alike. The other cuts that are coming that have been proposed are cuts to the Education and Workforce Committee, which is where WIC, TANF, and Head Start are located, and those cuts are proposed at $330 billion. And so once again, as I mentioned, WIC has its budget now of $7.6 billion. So right now it's protected, but there is conversation in regards to TANF and Head Start. TANF is the Temporary Assistance for Needy Families program, which is a block grant given to states each and every year to remain the same for the last 25 years. So however much your state received 25 years ago is how much they receive today. And so what this program does is depending on your state, how they use it, it can go to things like food assistance, healthcare, education assistance. And then for Head Start, once again, it's an early child education program that is used for low-income families. And then last but certainly not least are the proposed $220 billion cuts to the ag committees, which is where SNAP is located. And once again, last year we fought against the $30 billion cuts to the Thrifty Food Plan, which is how we calculate how SNAP is given out to individuals as well. So why are they doing all of these cuts? Once again, one of the major priorities of this current administration is to do tax cuts and breaks for some of the more wealthier Americans and corporations, and have once again, the trickle-down economics to come through in regards to that. And so they have to find a way to pay for it. If you remember in 2017, when the TCJA, the tax cuts bill under the first Trump administration was passed, one of the items that they caught heat about was that there was not a way to actually pay for these tax cuts. They're trying to prevent that conversation by actually cutting programs and feeding into one of the more conservative talking points around balancing the budget and having an actual balanced budget, and tackling waste, fraud, and abuse. So you'll hear a lot of that over the next couple of months as well. Um, and so we've been advocating for the protection of the programs of SNAP, WIC, and Medicaid in those conversations as well. The other part to it that we know are that along with the expansion of the tax bill, there's also the administration wants to ensure that there are no tax on tips, Social Security income, and then as we have recently found out that the administration is also trying to figure out how to give each American citizen $5,000 in a tax rebate. And so all of this has to come from somewhere. And once again, they're looking at cuts to vital programs in order to pay for all of these funding mechanisms that they want. So once again, we are showcasing that for the 40 million people who are on SNAP, the 80 million people who are on Medicaid, that these cuts will be detrimental to the health and nutrition assistance programs that are very vital to keep people fed and healthy. And without these programs, it's going to have even detrimental impacts. Even if citizens do receive that $5,000, they're still not going to be able to, especially in the increases in food products, not be able to sustain themselves in a long period of time.
Thanks. Thanks a lot, Tashawn. And, and just acknowledging both the, all of the work that we're doing and have ramped up to prevent, and that includes the media work as well, but to prevent those massive cuts that could have huge impacts on families with low incomes and other vulnerable communities. Also, the work that we are doing proactively, as you said, as a part of this tax bill to actually, where I think we can still have opportunities to take ground around things like a child tax credit, an expanded child tax credit, and protecting the earned income tax credit, again, for low-wage workers. So we are both fighting a defensive fight and also absolutely committed and working with our grassroots and with the Hill to also make proactive progress on that. I'm gonna open it up in a moment to Cricket, just to say if there's, based on what the your colleagues have shared, if there's anything you want to share. But I also just want to give a shout out and note in the chat. We're also honored to have our board chair on this call, Kul Gautam, the a former undersecretary in the UN and a former deputy executive director of UNICEF at the time of the biggest leaps in the child survival revolution. And he made the point that the impact of the demolition of US AID has affected not just USAID programs, but the whole ripple effect that Colin also touched on around and other programs around the world. And also the US withdrawal, especially from, stepping back from NATO. We've already seen a domino effect of other countries cutting their aid budgets and increasing their military budgets as well. So we're seeing that as well from other high-income countries, in Europe, and that is again having huge impacts in Africa and Asia and elsewhere. But Cricket, over to you.
Thanks, Joe. I would say, the work that Results has been doing over the past couple of months has been, it's been busy. It's definitely been busy. I would say from, the Hill and kind of the responses we've gotten, just in the past 3 weeks, we've seen a much more openness, especially from our Republican colleagues in the Senate and the House, to hear more and to learn more about the disruptions. They want details. I think that one of the things that has been very clear is that the administration and Congress aren't necessarily talking on these deeper levels about what is working and what's not, especially with dismantling of USAID, and what programs are still on which programs are still off. There's no accounting. And there's no regular updates that Congress is getting. And so they themselves are getting really frustrated across the aisle and across both chambers. We're seeing some real desire to push back, but some of that has got to be behind closed doors and behind the scenes. We know that there was arguments over what was going to happen with the CR, how that was going to move forward from our Democrats versus Republicans. I think one thing was clear on the foreign aid, that continuing resolution for the programs at USAID, it was going to be our best bet for the amount of funding and maintaining the full funding for the programs. Even if we wanted to see more restrictions and more accountability through what would be attached to a regular order appropriations bill that had the strong bipartisan support and the report language that we wanted in it, having the continuing resolution not cutting the programs was really, really important. I also wanted to say one brighter note that folks may have missed on Friday afternoon. There was an amendment on the Senate floor trying to cut foreign aid by in the FY25 bill. Rand Paul put forward an amendment, I think it was 16 billion cut to show like movement towards these DOGE cuts altogether. Now that 16 billion didn't declare what it was for. It just said top line, we're going to give less. And it didn't have anything to defining where that money would then go, or how that money, how those cuts would be spread across the agency. It would have been given kind of an empty check, if you will, for cuts, or an empty, I don't know what that equals, but free reign for cuts. How's that? And on Friday afternoon, we had a vote of 73 members of the Senate voting against those cuts in a bipartisan fashion. So 27 members, 27 Republicans voted in favor of those cuts, but 73 voted against it. That's a huge, like just a statement right now, considering how few people have been able to speak publicly or been willing to speak out. But I think that is breaking. And I want to say that we're seeing more and more members saying things either off the cuff with a reporter, or even some tweets saying that we really want to see more around the details of what these cuts entail, and how are we actually reprioritizing the resources and making sure that the humanitarian assistance, life-saving health work, the development assistance are back up and running. And I'm seeing that from both sides. Of course, we saw a lot of that from the Democrats early on, but now we're seeing a lot more of that and more willingness from our Republican colleagues as well.
Thanks a lot, Cricket.
Yeah, I'll throw the link in there, Emily, around the, and I think we may have that going out in the weekly update as well today.
Can you just say that what that is, Cricket, for people that maybe?
So Emily was asking about the vote for the
Sure. Great.
for the Rand amendment, and so this gives you an idea.
And who we can thank, right?
Yeah, you want to make sure those 73 members,
Yeah.
some are unexpected.
Yeah.
Some of those 27 members are unexpected as well, the ones who said yes, cut. But some of those 73 members, senators, are unexpected, and please do thank them for standing up and protecting the foreign aid funding in that FY25 final bill.
Great. And maybe now we can move to open it up to some questions from all of you and have some continued dialogue on that. But just as we do that, and Melissa, I think you were going to be able to run through some questions for us. I just did want to acknowledge again that from people that we've heard write in, that we've got people on this call who've served in the U.S. Agency for International Development, whose families are affected by the dismantling of that agency. And also participants who wrote in for this call about comments about how their communities, in some cases their own families, will be impacted by the proposed cuts to the US anti-poverty programs as well. So just so much harm done, and acknowledging that that is something that I think has been painful to all of us, and personal to many. So thanks for being with us. And Melissa, over to you.
Thank you. Thank you for all of you who submitted questions before the meeting with your registration, and for those coming in on chat, feel free to keep sending those in or raise your hand and you can speak your question to our presenters. I can start with a few. Mary Lash asks, what are the discussions about the CTC and the EITC for fiscal year 26? And Pravin Soni asks, where can we find the details of the cuts and number of people affected in each program that is being cut? This will help in discussions with members of Congress because it provides a human face to the chaos in progress.
So
Yeah, go ahead, John, please. Yeah.
yeah, I can answer the CTC EITC question quickly there, and pass it over to Cricket as well. But
And Tishan, if you could also explain to those on the call who might not know what CTC and EITC are. I'm sure it was part of your explanation, but just to make sure everyone knows what we're talking about.
Sure. So CTC is the child tax credit. So if you have a child under a certain age, you can apply for a tax credit for that. And then the earned income tax credit is mostly for low income workers, low wage workers as well, to provide them some tax benefits as well. So so there have been several things that have occurred in regards to the expansion of the child tax credit. So in 2017, the credit itself, pre-2017, the credit itself was $1,000 maximum. And then after 2017, it was increased to $2,000 maximum. That, as the baseline, expires at the end of this year. So if they don't do anything or in regards to that, it goes back down to the $1,000 level again. Since then, we've had several reiterations of increases to that. So during the Biden administration, in his first year, there was a true expansion of child tax credit to where families received a certain amount every month for about 6 months or so. And we saw child poverty go down dramatically. And so we now know, after that, in 2024, there was a bill, a compromise bill on taxes that was worked out by, at that time, the Democratic chair of Senate Finance and the Republican chair of the House Ways and Means Committee, to really tackle tax credits, including the expansion of the child tax credit. That bill had bipartisan support. Well over 2/3 of the House of Representatives voted for it. And then when it made it over to the Senate, because it made it over too late, it became a more politically charged item. And so therefore it did not pass the 60 vote threshold, but did receive a significant amount of bipartisan votes to take it forward. And so what's happening now in these conversations is that we want to ensure that that compromise package is continued to be the baseline for conversations in regards to child tax credit. When it comes to the earned income tax credit itself, we are noticing that there are some members who would like to make it a choice between you getting the earned income tax credit or child tax credit, but also using the earned income tax credit as the pay for to increase the child tax credit as well. So that is not something that we are advocating for. While yes, we are advocating for the expansion of the child tax credit, we should not be doing it off the backs of low wage workers as well, who deserve the tax credit. And in most cases, and in many cases, the folks who are receiving the earned income tax credit are mothers who are returning back after having a child in the first place. So it will be detrimental to even cut the program, even though you're trying to increase it for the child tax credit. But Cricket.
Yeah, I was just going to note, Mary put in the CTC and EITC and FY26, talking about them as there, in the same kind of sentence. I would just want to make sure we're talking about child tax credit and the earned income tax credit are part of the reconciliation bill process. It's called the budget reconciliation process. So when you were hearing about the budget that Tashawn put forward earlier and those massive cuts, that is through this budget reconciliation process. But at the same time, there will be the appropriations process, and they're going side by side. The appropriations process will still have a kind of a top line budget that is set. There will supposedly, and they will go through each of those spending bills, including our foreign aid bill that we focus on for the most part, and that, like Sean was talking about, WIC, that goes in the ag bill for annual appropriations, whereas these cuts in reconciliation are mainly looking at some of the SNAP and Medicaid, which don't get funded through the appropriations process. They're part of the they're part of the mandatory spending that we have to have. And so these cuts in reconciliation would change how we do our mandatory spending.
It'll be part of that big tax package.
And
Yeah.
as part of the tax package versus how we're doing this other work in appropriations.
And I think for other people that aren't as familiar to our work day in and day out, the only thing I would also add to Sean, which you touched on, but also to add, like, you know, for your team and, you know, the U.S. Poverty Policy team and Cricket, and especially like the amazing work our grassroots did when that House package, that House tax bill that didn't then pass the Senate in 24, but when that was passed with an overwhelming bipartisan majority, I am really proud because results advocates were a key part of that, and a key part in even negotiating increases for the child tax credit for the lowest wage workers. And as a part of that, including like if you had that, you would get your child tax credit not based on like per family, but per child. And other ways that it would expand it for particularly for low income workers who unfortunately get less of the child tax credit. You get a lot less of a child tax credit if you make $15,000 or $25,000 a year than if you make 400. So trying to like reverse that, and because of the work that we did with the Ways and Means Committee and the Senate Finance Committee, and more broadly in the network, that we played a really key part in that, and I hope that can be the baseline for the tax negotiations going forward. John Hornby, I see that you have your hand up, so welcome, and we would love to hear from you.
Oh, thank you. My question revolves around the continuing resolution that runs through September 30th. The minority party had a lot of angst about whether or not to pass that. And I guess my question is, on balance, do you think it was a good thing that it was passed, or what would have happened if it had not? I know the government would have shut down, but what would have been the long-term effect of that?
Yeah, I can try. I think that we were disappointed that Democrats did not fully use the leverage in the moment. We were pushing at the last minute for the CR, for folks to not support the CR as it stood, because we wanted to see the other option that was on the table. There was a 1 month, CR that was being presented. You had the kind of the top four corners of the appropriations committees, meaning the ranking and the chair of the Senate Appropriations Committee and the ranking and the chair of the House Appropriations Committee. They had come to a pretty much an agreement before that CR movement started. And we knew that agreement was real, that it was something that we could write bills to, that would provide more direction, right? And have more oversight on the funding. But it's really hard, especially for people in poverty and around the US when we have a government shutdown. We have, especially here in DC, our federal workers are one set, but we have a ton of contractors that are working in the cafeterias, that are supporting lawn maintenance, that are doing all the work around cleaning and support staff for our federal federal buildings, same around the country in all of your federal buildings. And so really a federal shutdown is really difficult, and a lot of people don't get paid back. While some, people do, our lowest income earners often don't. So it would be really hard to say how they would have gotten out of the shutdown. There are that there were pushes that to have that one short-term CR, and then you could move forward, but without having that short-term CR and having a shutdown under this administration, and picking and choosing what agencies come back online and who's prioritized could really be destructive. So we we
Yeah,
saw both
thank you.
sides,
It was a tough one.
but
Yeah.
of course, really, wanted that 1 month CR, because that was a pathway forward that had the accountability we wanted, but are glad that we are funded and live to fight another day for these programs. And I think that that's where y'all coming in, where, the resources that you give to help results here really matter as we push to make sure that the dollars that were allocated and appropriated for FY25 are actually spent with congressional will and intention.
And also, like we said, these big new decisions going to be made about hundreds of billions of dollars are also shaped by by the work that we do. I'm conscious that we're getting toward the end. Melissa, there's a few more questions that people had sent in. Do you want to just run through those last questions, and then we're going to go for really short, sort of brief answers on that, so we have time to get to those before we close.
Yes, let me touch on just a handful of the questions, and each of you can take a moment. We have two questions relating to our strategy with engaging members of Congress. Ruth Thurman Scott asks, considering the frequent changes, I'm interested to learn whether Results' campaign strategies will be modified for immediate future meetings with members of Congress. We have a question from Kathy Nelson. Which House and Senate committees are the most important ones to contact? Bruce Davidson up in New York asks, how do we save the programs and eliminate corruption and graft? Another guest asked, how can we stop this in our states and locally? I'm tired of yelling from the rooftop into the void. We have a few more questions on USAID, but let's stick with those for now, and maybe our last few minutes together.
Let me actually start with the last question first, and I think I can tackle some of those there. So in regards to something that we're seeing right now is a true education of the intersectionality between state and federal in regards to what things get funded. So for example, when we're talking about cuts to SNAP with Medicaid, most people don't understand that the federal government funds these, but in your specific states, they may go by a different program. So for example, if you live in Texas, SNAP is called Lone Star. If you live in California, it's called Cal Fresh. And so someone may say, I want you to cut SNAP because I think this is a waste of money. But then they'll say, don't cut Cal Fresh, without realizing that it's literally the same program. There are a few programs that translate like that. Like, for example, WIC is the same federally as it is on the state level. And so most people are supportive of that because they understand that's how they use it. So in some of that, it's truly an education of these programs are the programs that you are saying cut are the same programs that you're saying keep. So it's some of that education as well. In regards to our strategy, we are, continuing to push folks to get meetings with staff and members to build that relationship. We know it's difficult now. We know there have been some members who have decided not to hold town hall meetings, or some who are stopping kind of their face-to-face meetings, but that does not stop us from still meeting with them, meeting with their staff, and trying to educate them on why these cuts are detrimental to their constituencies. And so we're using the same tactics there to try and get into these offices. And once again, when they see that it's truly a constituent who is caring about these, they are more than likely to listen. We are, once again, pushing through the plateau and on some of these items, but it's still the same. Once again, as long as Congress has the ability and is forced to vote on some of these items, we have a voice to play in that as well. And so we have to continue to use that approach of just educating, talking to them, talking to their staff, and getting them on our side.
Yeah, and just to add, the committees that we're looking at, I saw the question there was, on our foreign affairs issues, the House Foreign Affairs Committee, the Senate Foreign Relations Committee, and our appropriators are our key defenders and the folks that we're looking to hold the line on foreign affairs. On the issues around our domestic campaigns, specifically looking at the reconciliation cuts. You have the Ag Committee that's going to be focusing on SNAP on both the House and the Senate side. On the Senate side, you have the Finance Committee that is supporting our tax work. And you have the Ways and Means Committee on the House side for supporting the child tax credit EITC work. And then on our Medicaid fight, it's Finance Committee again on the Senate side, and it's Energy and Commerce Committee on the House side. So we're going through a lot more committees and have a much broader focus this year. So I mean, some of you may never have had a member that we were like, do this exact thing, but now, ooh, all these committees, a lot of wealth in trying to get this together. And I will say our changes in our strategy, it started when we started doing emergency updates immediately. I think that we are recognizing that we need to be in and more often with these offices. We definitely need a full court press on some of these freshmen. Actually, if you saw that Senate vote that I was talking about on the Senate cuts to foreign aid or not cut to foreign aid, it was all the freshmen except for one Republican. All freshman Republicans except for one voted to cut. Now that it tells me more than anything, they're just not educated and they have not met our grassroots yet.
Yeah.
So turn it out, get in front of them, start talking and educating those offices. And I think
we're gonna need to close now, like kind of pivot to a close. I do want to say thank you team. So you see, like part of what your resources support and what you support is an amazing team of people. I think what I would just say before I close and thank you all, to the point Cricket was just answering, I think the other thing about the power of our model is we don't have millions of people, but the people we have like are so deeply engaged and knowledgeable and getting updated and getting supported that they are able to go in deep with members of Congress and really shape as constituents their responses to these things. And we are also able to shape the tactics. So if members of Congress on the majority side, Republicans are not as willing to say stuff publicly, then we can support them to say that privately to the decision makers. And so we pivot on both, some of the strategy, but also some of the tactics. And part of what allows us to do that is the depth and support for this amazing grassroots network. And that is really a big piece of what you make possible. So just to say thank you to all of you for joining us today. I hope this has been helpful. I just want to say your support is so incredibly important to us, especially now. It is hard for all of us on this call not to be overwhelmed right now and wonder if there really is a way to make a difference. But I personally have hope because Results is so uniquely placed to meet this moment as a nonpartisan organization with that deeply engaged constituent network across the country who engage members, across the aisle and across the political spectrum. It's going to be an intense effort right now and also a long fight to restore and protect these life-saving programs. So we're going to need to ramp up the pressure even further and keep it up. And so to meet that need, Results has launched an urgent needs campaign. Our goal is to raise $450,000 from individual donors over the next months. That's between now and the end of our fiscal year, which is September 30th. Because we need to maximize our political muscle with more advocates engaging with lawmakers in more districts and states and with the media right now, as we've talked about. And also, we didn't really touch on this, but right now we are seeing an almost unprecedented surge of interest from potential new volunteers. They're signing up for new volunteer orientations and eager to join groups and to go to congressional meetings. And your support is going to allow us to grab that energy and train them as potential advocates and integrate them into current groups, or to form brand new groups in new places in the country where we're underrepresented. And it's going to allow us to react to the onslaught of the challenges while also being proactive as possible to shape the leadership we want from Congress. You're going to be hearing more about this campaign in the coming months, but you can go to results.org, donate now or anytime, and add your support. And again, immense thanks to you for all of your support for joining us today. I hope this has been useful, and we look forward to staying in touch and working with you closely to reverse some of this damage and shape the future that we want. So thank you. Thanks. Thanks, everyone.